My name is Steve Trout, and I am 68 years old. This is my wife, Marie, and we are here because we want to talk about stem cell procedure. I have had severe neck pain for over 20 years now, and I've tried several opportunities with different doctors and different procedures, and I got some minor relief. Then eventually, after some physical therapy, I was recommended to see Dr. Jaffrey. Dr. Jaffrey reviewed my history, did some tests, we did some facet injections, which all had a good effect on me. And then we talked about the stem cell procedure and what it would do for me. Marie and I discussed the stem cell surgery or procedure, and then we went ahead and with the procedure. And since having the procedure, I have been able to reduce my narcotic pill intake, and also my neck pain over the last few months has reduced, and I am rapidly approaching zero narcotic use. And the stem cell procedure has been able to lead me to have a life that I can be back to what's normal for a person my age, working outside, walking, and all the activities that I like to do now. The first month you just felt something, but you never knew what it was, and it really got to the point 2 to 3 months you could tell that the pain was really starting to subside.
Wow.
And we were very happy with that. As the time went on, the days, the weeks, the months, it gets better and better, and to the point now where we've never had pain for the last month, any neck pain that we had before we came in. So our goal when we came in was to be 100% off narcotic drugs, and we are rapidly approaching that point, and we're very satisfied with that. We're doing it slowly, so the side effects are minimal, and even in our case non-existent, so we feel good about that. But that is our goal, and that's what we're shooting for.
When Dr. Jaffrey gave us the option of looking at a stem cell, we discussed it a lot, and a lot of people have, I think, reservations because it's not covered by insurance. And so we had a lot of discussion about that, and we finally came to the point that being pain-free was worth whatever we had to give up as far as the cost for that. So it was an easier decision for us to make once we decided that the cost wasn't something we were going to consider. We considered the risks and things like that. But then once Steve had the procedure, again, everybody here at the clinic was very good about explaining everything to us. And so there were no surprises. We knew what to expect pretty much. But since then, Steve, I garden a lot, and so he's my maintenance man. And so I could only depend on him for about an hour or so, and he would say, I'm spent, I can't do anymore. Now, he can be out all morning. So from the pain aspect, that's good, but also because he is pain-free, he's 100% pain-free now, and he's reduced his narcotics, there's a whole different ease about him. There was a tenseness with, when you have pain all the time, you might be a little more short, and he's never had a temper, so I hate to say short-tempered, but there's just a tenseness because you don't feel good. And then also what a narcotic does to you. And that to me is a dramatic difference. It's like it's lightened his spirit a little bit because he is not dealing with pain 24/7. So that's been, to me, I don't care what insurance covered or not, that's worth everything to me, is to see that his attitude is lighter and he doesn't have that burden of pain all the time.